Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAX. Thank you for joining me in my latest video using the WAXscope. And here we have an elderly patient, bless her, she's 98 years of age, who's really had a tough time with her ears over the last few weeks. So as you can see, her ears are full of earwax and dead skin. And they visited another clinic who initially attempted to perform microsuction, but really struggled. And I can understand why that is the case. They've got a really narrow entrance to the ear canal, and that's because they have what we call a canal. So the outer third of the ear is made up of cartilage, and the cartilage in the ear and also our nose, so the lower two aspects of our nose, is also formed of cartilage. Over the years, that cartilage weakens and then gravity takes its toll, and so that can lead to a droopy tip and also a collapsed ear canal with the cartilage at the entrance, because it's weakened and gravity is pulling it down. It kind of just falls over each other, sealing the entrance. And it means it's very difficult to get access. Now, I'm having to use our smaller specular size just to dilate the ear to remove this. So this is our 3.5mm specular. So after their first appointment, they were asked to use some drops. They returned, and again, unfortunately, they weren't able to remove this wax. So they resorted to ear irrigation, and that was also unsuccessful, but worse still, it led to this patient developing otitis externa as a result of the procedure of the irrigation. So they then visited their GP, who prescribed some topical antibiotics, and once the infection cleared, they booked in with myself and we just removed this. You can probably see there's some red marks, and that possibly it could be some dried blood from when they had the infection. I'm not sure. And although this patient had used drops and had water inserted in the ear, this wax plug was really dry. So I doubt very much the water or the drops itself had actually penetrated the deeper part of this patient's ear canal and given it so narrow. Because if it wasn't for the specular, the entrance was almost completely sealed. So the specular helped to dilate it. So just some residual skin there. And now just trying to visualize the eardrum. And it was, again, very difficult even inserting the smaller size specular in this patient's ear, but we managed to get in there. You can see there's a bit of tympanosclerosis, so there's some opaqueness of the eardrum, and that's just some scar tissue. So this patient, it could just be their age. Over the years, there's so much sound hitting the eardrum, and you just get some formation of calcium deposits. So you get calcification of the eardrum, which we call tympanosclerosis, but actually that's probably more meningeal which I'll explain in a different video, the difference between the two. Well, I hope you enjoyed that video, guys, and if you are interested in the WAXscope, if you're a specialist performing earwax removal, please email info@clearwax.co.uk. Thank you, bye.